Hi everyone, welcome to Edge Computing in Action. I'm Helen. So we all hear about AI in healthcare, but what does it actually look like in a hospital? And how is it changing things for doctors, nurses, and patients? Well, today we have Frank to break it down for us. Hi Frank, good to have you.
Hi Helen, nice to meet you.
Hi, so Frank, let's start with the basics. Right, so can you give us an overview of how Advantech's iHealthcare teams focuses on?
Okay, thank you Helen. Advantech iHealthcare mainly focus on two areas. The first one is the enabler to support a medical equipment or the device manufacturing company to make a better innovation and a better computing performance in their system.
Right.
So we call it an enabler. But another one, especially, focus on the using the mature IT technology or transforming come up with the solution-based product into the intelligent hospital. The major purpose is to make the efficiency workflow and a better outcome in the hospital management and their daily work. So Advantech have various products, for example, like a computing, like the medical display, in the OR's video management system, also including the medical trolley car and also the solution-ready package to different customers. So based on this kind of a two direction, we aiming to 5 domain-focused market. We call it like a nursing care, we call it a medical AI, or even a medical company, or even the OR and infrastructure, or even the other application. So this is Advantech what we are doing. So our vision actually in AI for the future of iHealthcare, we put it like a leading edge computing and the hospital solution in healthcare market.
Wow, so it sounds like a whole ecosystem to support this healthcare system, right? But there's a term that really piqued my interest. You said about an iHospital.
Yes.
What is it all about?
Okay. iHospital majorly, when we talk about iHospital, is a very complex work environment and also the application. So I'd like to take one of the themes, key themes for the interoperability.
Right.
So we separate the different level of interoperability in healthcare solution. For example, in the fundamental, the legacy application of the manufacturing of the equipment or the device, they are to be used in hospital for many years. It's called legacy, but not able to communicate or even link to other device or even the other system. So it's fundamental interoperability is like kind of a first level. The data are able to be digitalized, to be visualized, and linked to other systems together. And second one, in most complex working environment in hospital, for example, in the patient room, or even in the integrated operating theater, this kind of a system, a lot of a subsystem inside. All the systems, they have to be linked and exchange the data together. So including the different hardware, include different software and the solution, they are combined in one complex working environment. So it's like a structuralized interoperability. But in third level, we are talking about is most likely more semantic. For example, using and leverage AI's capability and the performance. So all the data can automatically into the workflow, automatically together, or even share to different systems. So all the information inside the hospital, including healthcare for patients' data, or even the hospital management, are all transparency. But finally, the intelligent hospital will be like organization interoperability, because each hospital or even the big medical center, they have their own valuable data. But how to use that kind of a big data to share together to create more value, even like a patient-centric care, or even the predict analyze to understand that the patient will be the future get any disease, or even have a prevention in the future. This is optimization for the interoperability. So this is a whole structure we talk about the iHospital.
Wow, that's really comprehensive, right? So it's mainly to make the hospital working more efficiently and also reducing the loading for the admin team.
Yes.
And also earlier you mentioned like different aspects that you focus on, including the nursing cares, medical AI, and also the hospital infrastructures. So can you elaborate more why focuses on these sectors?
Okay. So when we talk about a solution in the iHospital, eventually you can think about like a sub or individual system, but you can think about most workload, where they are. The first one, especially for nurse, because in the patient care daily process, a lot of activity, a lot of device, a lot of action, even the medication, fall down detection for patients safe, or even the medical instruction need to be processed in daily work. So eventually in patient room, that kind of a daily regular process is still quite complex and not easy to reduce the working load. So by nursing care, we talk about the complex one, but we think about how to simplify or even reduce the workload of the nurse to create more outcome in the patients. So the first one. And second one, we talk about the hospital infrastructure. You can think about, for example, in hospital building, a lot of different systems, even the air condition, the power management, or even the outpatient journey when you go to the hospital to visit doctor. You need to registration, make an appointment, find the right clinic examination. To do all the process is quite complex and lose a lot of time for waiting. So how to use IT technology to help people, even the patient or even the nurse workflow and doctor clinics will be one important thing. Furthermore, like medical AI can use everywhere in hospital because all the data, all the process, when the information gathering, they are able to be shared and they use the AI algorithm to help the hospital's management in their daily operation to make more efficiency, or even like a ESG purpose, they're able to come up with a power management system to predict, to provide good suggestion for the hospital management people, or even when in the OR, the more predict video analyze or even the navigation is supporting doctor to make the right decision and during the OR to reduce the time and have a better patient recovery. So all these kind of things we are thinking about will be the future and it will be really the trend in the iHospital market and in the future.
Wow, that's really impressive. I mean, by improving these sectors, it can actually increase the quality of healthcare, right?
Yeah.
And also, Frank, you mentioned different stakeholders,
yeah.
right? Including nurses and doctors and also patient and team. So I wonder, how can the Advantech solution bring values to those sectors, to those stakeholders?
Okay, so when we talk about, for example, in the patient room, there's a lot of systems, as I say, in the daily workflow. So how to use one dashboard or even the solution-ready package to link all the systems will be the very, very important things. Because all the information that nurse need have, they can use one dashboard to really analyze the patient status, the medical instruction the doctor give, or even when they need to do the vital sign management, or even the medication error reduce. So that kind of a management system, when you got a one platform, linked to proof solution in the hospital. So combine those information in one system, one solution, is really helping nursing's workload, especially everyone know. For the nurse, their workload is very high.
Right.
And right now, even in the worldwide, the nurse resource is getting lacking off and the people are aging. So eventually, how to use a better efficiency workflow, even automatically to support the nurse to take care for patient will be the most important things. So this is the first one. And second one, in hospitals management, for example, for the assets or even the OR scheduling, the usage of each assets or even the equipment or device, or even how many patients visit this hospital, how the clinic workflow, inpatient, outpatient workflow, make more efficiency, wrong rate for the patients visit hospital or even visit doctor. So even the medication taking, curing system, all the management is really complex for hospitals management team. So in daily, they need a lot of key index to identify how to let operating of the hospital to be much better and efficiency and make patient to be more satisfied. So including other solution or even the air pollution or condition kind of detection in hospital, the power energy related to ESG is also the one key point that all the management in hospital they care about. So including that kind of a combination, they can benefit with a different stakeholder, or even have a better revolution in all hospitals operating or taking care to the patient, or reduce a lot of effort. So that kind of efficiency or even outcome would be really a tremendous big change to shift the healthcare market.
Amazing. That's a lot of benefits, right?
Yeah.
So first of all, like ESG, and also to ease the burden of the admin team. That's so important.
Yes.
And also to utilize the data efficiently.
Yeah.
Right. So finally, as COMPUTEX is around the corner.
Yes.
So can you give us a hint that what can we expect to see at COMPUTEX?
Okay. At Advantech iHealthcare in COMPUTEX, we were using a different angle to do the demonstration. We used the iHospital's perspective to real demo from the patient to visit hospital. They have an outpatient journey to make the appointment, make the registration, to check in, the queuing system, or even a payment. Second, in intelligent patient room, we will have an iWall kind of a solution-ready package, combined with different collaborative parties solution inside to demonstrate how to really help nurse to be better efficiency to take care for the patients. And third one, going to the backbone and the core of the iHospital is in the OR room. We will work with our co-creation party with the medical AI application in endoscopy surgery, even with the surgery navigation accuracy, more better outcome to save patient life and recovery. And even more, with iHospital's management, we will have an intelligent energy management system to able to support the hospital to implement the ESG perspective. Not only this kind of a demo will be in COMPUTEX, because this will be the scientific, really ongoing case in the field and the hospital already. We will have more demonstration and application and the solution. We are all welcome to understand it with us, and we will express more information with you together. Thank you.
Well, thank you, Frank, for this wonderful sharing. Right, so that's all for today's show. And it's amazing to see how technology is making a hospital and healthcare system more efficient and safe. So if you're interested in iHealthcare, please stay tuned for more and more topics. Right, that's all for today's show. Thank you for joining us, and I'll see you next time.